tight hip flexors is usually associated with what's called the lower cross syndrome. The tightness of the hips usually cause the hips to tilt forward, which is called an anterior hip tilt. The goal is to get your hips back into that neutral position by strengthening your core and your glutes. First step is to address this tightness. You want to grab a firm foam roller or a ball and place it right on that tight hip flexor. Make sure to apply a good amount of pressure on that spot for about 30 seconds. It should be a little bit tender depending on how tight your hips are. This should loosen up some stiffness in your hips. The next step is to fire up those glutes. So grab a small circle band and place them right above your knees. And now we're going to perform a simple glute bridge. You want to make sure that you're pushing your knees out the whole time and really contract your glutes for about 10 seconds. This should really activate your gluteus maximus and medius. And I would also perform this same workout for about 3 sets. And last, we're going to perform one of my favorite core workouts, which is the partial curl up. All right, so this is a great way to activate your core without using your hip flexors. So first, you want to place your hands right under your lower back, and then you want to really engage your core nice and tight and raise your head slightly off the ground. You want to perform this for about 10 seconds and for about 3 to 5 sets. What makes this workout so ideal is the fact that we are eliminating any hip flexion while also engaging our core. So just a quick recap. First, we want to address the stiffness in the hip by foam rolling. Then we want to improve that glute activation by using the banded glute bridge. And last, you want to use